Assalamu alaikum. Welcome to Majlis Ashura Islamic Leadership Council of New York's first webinar series. Today's topic will be about what Muslims need to know about the COVID-19 vaccine, a very timely topic. And today we'll be addressing many of the community's questions and concerns regarding the vaccine. Today we'll be talking about topics ranging from the science behind the vaccine, in addition to religious implications, and also just the logistics behind vaccine rollout. And today we have some special speakers with us, including Dr. Badr Al-Hussein. Dr. Badr is a medical doctor by training with a background in internal medicine, primary care, specializing in clinical risk management, patient safety, and regulatory compliance in the New York metropolitan area. Sheikh Ibad Wali, who is our resident scholar at Majlis Ashura, the Islamic Leadership Council of New York, and he's also the executive director and resident scholar at the Hillside Islamic Center in Queens. And then we have joining us today Moses Mansour, who's worked for the New York City Department of Health and Mental Hygiene for over 20 years. He currently serves as the director of the Office of Faith-Based Initiatives and the Center for Health Equity and Community Wellness. He also leads the New York City Department of Health and Mental Hygiene's efforts in convening faith-based organizations citywide and addressing inequities in health. So we're very pleased to welcome our special guest speakers. We'll start first with Dr. Badr, who will discuss the medical implications behind the COVID-19 vaccine.
Assalamu alaikum. Can you hear me?
Yes, wa alaikum assalam.
Okay.
Welcome.
Inshallah, let me share my screen with you. Can you see it? Okay. Okay, can you guys hear me? I'm not hearing anybody.
Yep, we can hear you.
Okay, all right. All right, sorry about that. All right, as Lamia mentioned, so I'll be presenting basically kind of why we need the vaccine and a little bit of information in terms of what the vaccine, and to kind of highlight some of the popular or address some of the popular vaccine myths out there. And factual responses. Essentially why we need the vaccine, I mean, the impact of vaccines on eradication of common diseases is well known. Like, we can't really have herd immunity. And I know it's a popular term that many of us have been hearing as of late, and without having a vaccine. And, you know, we can see from this slide right here, with the vaccine, you know, we were able to eradicate a lot of the several of the diseases out there, if not mitigate some of the spread. For example, in 70s, you know, we were able to, you know, get rid of smallpox with a polio vaccine. We were able to eliminate paralytic polio. So we need that vaccine in terms of you know, getting rid of or at least mitigating the effects of the virus. Secondly, you know, the effectivity of the vaccine has been well documented, you know, at least based on some of the ones that have been given emergency use authorization, which we'll talk about today. But, you know, comparatively with the flu vaccine, you know, flu vaccine or the influenza vaccine usually has, depending on the year, here we have since 2009 all the way to 2019, the effectivity of flu vaccine in the United States. And it usually ranges anywhere between 40 to, with the exception of 2014 and 2018-19, 40% to 60% effectivity. With the Pfizer and the mRNA vaccines that we'll talk about that have been given EUA or emergency use authorization, they have a 95% effectivity rate. Pfizer with 95, the Moderna one has a 94.5% effectivity rate. So the vaccine we have is very, very effective. So, thirdly, the COVID-19 has caused more death in a single year than HIV has caused in the last 20 years. And this is UK numbers. These actually slide sets were prepared by a colleague of mine from Lancaster University. And so there's some information here from the UK. But you can see here 1.7 million cases already where well past that in terms of COVID-19 cases. So we need the vaccine in order to, again, reduce the impact. In terms of, one of the reasons why COVID-19 has had such a huge impact is because of its respiratory infection, and it spreads very easily in that regard. Here's a case in terms of something that happened in Maine, where there was a wedding, and one person out of 55 attended that was positive, attended that wedding, and it eventually infected, in addition to people within that attended the wedding, 177 other people, outside of that wedding. And then from those 177 people, there were 7 deaths. And these are all deaths that, of people that were not in that wedding. So that's why when we're talking about, maintaining social distancing and all of these things and the COVID precautions and stuff like that, that's why it's so important. Even though you might be a carrier, you may be asymptomatic, and it ultimately may not even be, you might transmit the disease to somebody else, and they may not be even symptomatic, but the problem is they'll transmit it to somebody else and they'll get the effects from there. So again, we need the vaccine for that. Also, the impact on livelihood. COVID-19, aside of having health impacts, it's also had some serious societal impacts as well. Here we have these are numbers from April 2020 in terms of unemployment and the industries that were affected. Obviously, numbers are much higher since then. Nearly 24 million people have applied for unemployment nationally as a result or due to COVID-19 effects. Also, in terms of the ability of people to earn a living because of these effects on across industries, is also impacted as well. And in terms of we mentioned in terms of natural immunity and having herd immunity, one of the popular myths out there is that, natural immunity is much safer or is better than, vaccine mediated immunity. And, to be quite honest, immunity from vaccine is a far safer route than natural immunity. And if we were, to let, and what vaccines do is basically allows for an entire population to get immunity from the disease without really having the disease or being infected with the disease. Natural immunity means that, people develop immunity by being infected by the disease. But with vaccines, we're able to have, natural an immunity within a population, and for populations that don't need to be infected. So herd immunity makes it possible to protect the population from a disease, including those who cannot be vaccinated, such as newborns or those who have compromised immune systems. So that's why vaccines are so essential. Now, in terms of information about the vaccines that we have readily available. So for many of you that you may know or may not know, they're actually aside from the 2 ones that we know, there are actually at least 225 current studies or vaccines being worked on. two of which have received FDA approval or emergency use authorization, which is the Pfizer vaccine and the Moderna vaccine. And as mentioned, the Pfizer vaccine is 95% effective, and the Moderna vaccine is 94.5% effective. Both of which are mRNA vaccine, and I'll talk about what that means in a sec. Both of which require 2 doses. And for the Pfizer vaccine, the 2 doses are usually within 21 administered 21 days within one another, plus or minus 3 days. With Moderna, it's 28 days, so about 4 weeks, plus or minus 3 or 4 days there as well. The duration of protection is not yet known. Both vaccines were tested on a diverse adult population, and on the next slide will show you the range and the demographics of the vaccines being tested. So with the Pfizer vaccine, there was 443,000, almost 44,000 people enrolled across 150 clinical sites in 39 states. The vast majority, again, are white population, but we have 13% that were Hispanic, 10% African American, 6% that were Asian, 1% were Native American. And we have kind of similarly in terms of the Moderna vaccine with a slightly higher number of Hispanics that were tested on. And also there was a lower number of participants in that study with 30,000. So in terms of mRNA vaccine, what is an mRNA vaccine? Basically, mRNA is a genetic material that teaches our cells how to make harmless proteins. And specifically, these mRNA vaccines are targeting the spike proteins, which is on the surface of the SARS-CoV or the COVID-19 virus. A genetic material from the vaccine is destroyed by our cells once copies of the spike protein are made, and it is no longer needed. Usually, the lifespan of an mRNA within a cell is about 4 to 5 days, give or take. Cells display this piece of spike protein on their surface, and an immune response is triggered inside our bodies. This produces antibodies to protect us from getting infected by the SARS-CoV or the COVID-19 virus. Again, because this is an mRNA vaccine, it does not affect our DNA. mRNA does not enter the nucleus, which is where the DNA is located. And just because you receive the mRNA vaccine, because it's actually not it's synthetic, and it cannot give you COVID-19 either. So yeah, and actually the mRNA vaccines have been around for the last 10 years or so, and they've been actually tested on flu, Zika, rabies, cytomegalovirus, and actually they've been used in cancer studies as well. So the technology has been out there, and this is kind of one of the reasons why we were able to get these vaccines rolled out so quickly. It was just a matter of tracking or making the genome sequence of the SARS-CoV-2 virus known, so that we can develop the mRNA vaccines. And so yeah, mRNA vaccines are expected to produce side effects after vaccination. These are typical side effects that we find in any vaccine that we take, whether it's flu, varicella, or shingles vaccines. These are common, which are fever, headache, muscle aches. There's no significant safety concerns were identified in the clinical trials. There was at least 8 weeks of safety data that were gathered in the trials, and it is unusual for side effects to appear more than 8 weeks after vaccination. And for both Moderna and Pfizer vaccines, no people that the participants that did develop symptoms did not last after 8 weeks after the vaccination. And that's why they were granted the emergency use authorization there. So this is reactogenicity. This is basically a fancy term for reactions caused by vaccines. So there are short-term side effects in terms of predominantly for Pfizer, and the Pfizer vaccine is fatigue and headache. For Moderna, there's a little bit more with fatigue, muscle pain, joint pain. And at my hospital system, we've already rolled out the vaccine, and we really haven't seen very much side effects. I think of the several thousand people that, or several hundred people that we've administered it to, only really 2 patients had reactions that were, outside the norm. And usually the reaction happens after the second dose, not the first dose. And the long-term side effects, again, extremely rare for vaccines generally. But in this case, we really don't know because we're still studying it. Unfortunately for this is that we're FDA, CDC, and a few other regulatory agencies are monitoring the side effects just in case. So in terms of what, this is kind of just a illustration of what the vaccine entails and some of the things that, the vaccine can do. For the Pfizer vaccine and both vaccines really, it doesn't really guarantee protection from infection. It does guarantee, or at least, we know that it will protect from severe disease. And from disease itself, so it'll likely prevent symptoms from developing. We're still not sure on whether it will block transmission. Some of the studies that are out there, or some of the theories that are out there, it probably doesn't block transmission, but we're still not sure, and the studies are still ongoing. In terms of long-lasting immunity, we're still not sure, but of the 94% or 95% of people that received the vaccine in the initial trials, none of those, 95% of those people did not receive COVID as of yet. Again, likely to protect from infection. We're not sure how long it'll protect. Still can transmit the infection, still have to self-isolate through test contract tracing. And some of the questions that come up are COVID-19 and recovered. Do I still need the vaccine? There's really not enough information currently available to say if or for how long the infection someone is protected from getting COVID-19. This is called natural immunity. Early evidence suggests that natural immunity from COVID-19 may not last very long. And we've had several cases, even including in New York City, where people that were once infected and then recovered also had were reinfected again. So it's recommended that those that did have COVID and recovered, that they take the COVID vaccine as well. And in terms of wearing masks, do I need to wear masks if I get vaccinated? It may take some time for everyone who wants a COVID-19 vaccine to get one. So while the vaccine may prevent you from getting sick, it is unknown at this time if you can still carry and transmit the virus to others. Until more is understood about how well vaccine works, continuing with precautions such as masks, social distancing is very, very important. And then, so the next part is going to be addressing some of the, the myths out there, popular myths that are out there. First one, does the vaccine manipulate DNA? This, again, this is an mRNA vaccine. The ones that we have to concern about ourselves in the United States are the Pfizer and the Moderna ones, at least for now. There's the AstraZeneca one that's still in development and hasn't been, at least authorized in the United States. But, mRNA is within the cells and is short-lived. Again, it does not enter, it only stays in the cytoplasm and does not enter the nucleus of the cell. So RNA cannot integrate into DNA, and there's no mechanism, with the exception of, at least for coronaviruses, there are, a subset of viruses that do, but for coronavirus, there is no mechanism for RNA to be reverse transcribed into DNA. And yeah, this is, as mentioned, it's these are, and according to the CDC, mRNA vaccines work by instructing cells in the body on how to make a protein that triggers the immune response, which we talked about. Injecting mRNA into your body will not interact or do anything to the DNA of your cells. Human cells break down and get rid of the mRNA soon after they have finished using the instruction of developing the proteins. And again, this ranges 4 to 5 days within the body. And then in terms of the popular, very, very popular myth about tracking and microchips, we don't have the technology to introduce these microchips or trackers into vaccines. So this is, again, a myth that was made popular because of, some statements made by Bill Gates. This is absolutely not true. If we're really worried about, tracking and stuff like that, if you're using a phone or, you're on Google, Facebook, chances are your information's already out there. Getting a vaccine won't change that. And then in terms of the AstraZeneca, just for the purposes of clarity and for people's information, it's not an mRNA; it's a non-replicating virus. Does not transmit from one cell to another, and it's a different type of vaccine altogether. And vaccines are made up from another one of the popular myths out there, that they're made up from a fetal cell lines. For the mRNA vaccines, the Pfizer and the Moderna, they're purely synthetic, and they're not using the MRC5 cells, which are usually derived from fetal cells. So we don't have to worry about that right now. But for the AstraZeneca and some of the other vaccines that are being looked at right now, they do have the MRC5 290 and 293 cells that are derived from tissue samples taken from fetuses aborted in the 60s and 70s. So these are the MRC cells, like, just to not to go into too much depth about these are like cell lines. And so over the years, these cell lines, because of how long they've been used, the fetal cell aspects is really been diluted over that time. So we don't have to really worry about that when it comes to the mRNA vaccines. But for the other ones, we can't say for sure. But definitely for the AstraZeneca vaccine, which is being developed in Europe, it does use those that cell line. In terms of genetically modified substances, yes, I mean, that's what vaccines are. But again, it doesn't affect the DNA. It doesn't alter anything within the body, really. And then in terms of vaccines, and Halal, I know maybe Imam Ibad will talk about this, mRNA vaccines are purely synthetic. They don't use any porcine or pork products within them. So they are, I guess, quote unquote, halal in terms of them being used. Another concern that's out there is, vaccine companies are getting, indemnity, meaning they're being protected from any liability or potential suits. And this is true because we are, and one of the other concerns is that, the rapid production of these cases or these vaccines is cause for concern. And really, these vaccines needed to be escalated because of how severe the impact was. So there were really two main, vaccines often take 7 to 10 years, for them to develop, but there's two reasons why they were developed with such rapid speed. One was the urgency, and most manufacturers out there, and especially the scientific community. I mean, I know for my institution, NYU, most of our research departments dropped everything and focused their efforts on COVID-19 and looking into that. So, it was all hands on deck with this. The second thing is that mRNA approach was already in development. So researchers had a way of getting mRNA into the body through the mRNA platform for trials, like, as I mentioned, in terms of, the Zika, rabies, cytomegalovirus, as well as within cancer research efforts. So what they just needed is to learn was the genomic sequence of the coronavirus. And once they were able to learn that, it just was a matter of time for them to develop the mRNA vaccine. Again, it was rushed through the approval process. Yes, true. For COVID-19, it took 1 year to really get this rolled out. Again, we repurposed technologies. Again, it was because of the urgency. This is just a reiteration of what I had said earlier. And then also funds were made readily available within, both public and private sectors to carry this forward. And then, mRNA-based vaccines are new. We don't have long-term safety data. That is true, but we do have safety data nonetheless. Below is for, and inshallah, we'll make this presentation available, are some of the mRNA vaccines that were developed specifically for viruses. And here you have CMV, or cytomegalovirus, Zika, influenza, rabies. And, you can look up, there's a registration number for people to look up, the side effects and the results of those studies. In terms of whether we want to take the vaccine, what are the instructions, or what is recommendation? I mean, we've had 71 million cases with 196,000 cases per day, and approximately now the numbers are much higher, 1.7 million deaths in a year, 4,000. Give or take deaths per day. That's 3 people dying every minute. But what we have now is a vaccine that's 95% effective, that's been tested on at least 73,000 people, with a 2-month safety follow-up second dose. So, really the choice is yours. And that's it.
Thank you so much, Dr. Badr, for I learned a lot from that presentation, so thank you. You brought up really important points about myths that I've been hearing all the time, and a really important point about how science has progressed so much, which is why an expedited vaccine is actually not as bad as we might think. Just one question I have, I don't know if you know the answer to this, but is with the new COVID-19 strain that's out, or COVID-20, I don't know what it would be called, but the new strain that makes COVID a little bit more easier to transmit to others, do we know whether this vaccine is equally effective on that?
Yeah, so I thought I had mentioned that, but yes, so with the way the COVID-19 was, or the vaccines were developed, the mRNA sequence targets the spike proteins and different elements of the spike protein. So with the new variant, most people are saying that it will be effective against this new variant. And by the way, this new variant is actually not just simply one variant. It's actually like a series of I think 30 or 60 variants. I forget the exact number, but yes, most experts are saying that the vaccine will be effective against the new strain. And even with the COVID testing that's out there, the current PCR testing actually, and maybe Dr. Moses has more information on that, can actually test for the new variant as well. So it's not like they're going to be undetectable. But with regards to the vaccine, yes, it'll cover it. Okay. Theoretically, yeah.
Thank you so much again, Jazakallah khair, for your time. And up next, we will have Sheikh Ibad Wali. Assalamu alaikum, Sheikh. Good to see you.
Wa alaikum assalam wa rahmatullahi wa barakatuh. Likewise. Jazakallah khair for having me.
Of course. I'll hand it over to you now.
Okay, inshallah. Again, assalamu alaikum wa rahmatullahi wa barakatuh. May peace, mercy, and blessings be with you all. Jazakallah khair for joining us. It's again an honor to be here and discuss something very important in regards to what we're trying to accomplish as a community, as individuals, that Allah subhanahu wa ta'ala gives us tawfiq to understand. As Allah subhanahu wa ta'ala has mentioned in the Quran, هَلْ يَسْتَوِي الَّذِينَ يَعْلَمُونَ وَالَّذِينَ لَا يَعْلَمُونَ. That are the two people equal? It's a rhetorical question. Those who know and those who don't know. Clearly, they are not equal. And that's really what we're trying to do here at Majlis al-Shura, that we are trying to educate, we are trying to learn. And it is knowledge, that is the power that Allah subhanahu wa ta'ala has given us to distinguish from the light from darkness. So I'd like to share this presentation with you. And in this presentation, I would again focus on the Islamic aspect of this. Please, if someone can just text me, let me know that they are able to see the presentation.
Yeah, we can see it.
So I'd like to begin with the verse to contextualize what we are about to do here, and what is the guidance from Allah subhanahu wa ta'ala in terms of our faith, our deen, our Quran, and our Holy Messenger, peace be upon him. أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم إن في هذا لبلاغا لقوم عابدين وما أرسلناك إلا رحمة للعالمين. Allah subhanahu wa ta'ala, he mentions in Surah Al-Anbiya, verse number 106, 107, that surely in this is a message for those who are devout worshippers. Those who worship Allah subhanahu wa ta'ala, the message is clear that we have sent you forth, Rasulullah sallallahu alaihi wasallam, as nothing but a mercy to mankind, a mercy to people of all worlds. That is really the foundation of our faith. When we look at the fiqh of COVID vaccination, we are going to delve into the two Islamic approaches, again, that are stemming from the verse that I have recited as the intent of our faith, of our deen, the maqasid, the purposes of our faith and our deen, and then debunking the myths, which Dr. Buddha has already mentioned, and dispelling some concerns that we have, and which he has also touched upon as well, and then providing a conclusion. So people generally ask these questions and need answers. What is the Islamic ruling on vaccines and vaccination? What should Muslims do in regards to COVID vaccine, Moderna, Pfizer, and others that are coming around? And number three, what is the responsibility of the Muslim community in fighting this virus? So I'd like to begin with the 5 objectives of the divine law, which is known as al-maqasid al-shari'ah. The maqasid of the Sharia are 5. What are they? And it's not one is priority for the other. They're together 5 objectives of our faith. And this is when you look at it and you see it, you realize these are objectives of humanity. So number 1, preservation of religion and morality, to have a system in which we find checks and balances as we interact with one another, as we interact with the government, as we interact with animals, as we interact with environment, everything that we interact with as individuals and as a community, to preserve, to find preservation in that balance through religion and morality. That is called hifz ad-din. The second objective is preservation of life and health, hifz an-nafs, where if you are alive and you're healthy, you're able to accomplish the task given to you by Allah in terms of worship, in terms of dealing with one another, in terms of doing good. Just doing good in life requires you to have good health. If you're not able to have good health, you need someone else to do good to you. So preservation of life and health, not only just life, but the best form of life that you can exhibit. Objective number 3 is the preservation of the progeny, hifz an-nasl, that preserving the future generations. That if we stop procreating, or if we do something that hinders the progeny, our children, from coming into this world, then we will halt and stop humanity from existing. So allowing humanity and preserving humanity to exist is also from the maqasid, the objectives of our divine law. Objective number 5 is preservation of the intellect and sanity, that is the hifz al-aql, that if we have health, we have life, we have children, but we're not using our intellect, or we're doing things that are harming us intellectually, then what is the purpose of life? Then we'll lose sight of the objective of our life, and go towards insanity, which is craziness, where Allah subhanahu wa ta'ala wants us to be intellectuals, to find the balance, and to live righteous and balanced lives. Objective number 5, preservation of wealth, and that is hifz al-mal, that a person would engage with one another, and the deen would promote such a system in all levels, whether it's a social, economic level, where wealth is something that your property, my property, is protected, is safe, that I don't feel harm. I'm not always concerned about what's going to happen to my wealth where I have satisfaction. And the deen, our faith, wants us. And it's not just wealth, it's also my children, my home, my spouse. All these things are considered part of wealth. And even the senses that I have are part of the wealth. When we compare these divine objectives in regards to vaccination, we find that in order, first of all, to develop vaccines and then to take vaccines, provided there are some restrictions and guidelines, which we'll talk about later, we see that the 5 objectives fall in line with production of vaccines and taking vaccines. So objective number 1, and I'll go back and forth just to make it easy, was what? To preserve religion and morality. Vaccines will enable Muslims to better practice their religion, right? And how will we do that? I will mention verses from the Quran, I will mention a hadith that clearly tell us that there are ways we can protect ourselves, and we should take those steps and then put our trust in Allah. So we will be acting on our faith by taking the vaccines, or even involved in as the Muslim couple that have taken the lead and produced the vaccination. This is wonderful news for all the Muslimin to realize and to also advertise that it was a Muslim couple, 2 individuals that helped, that were Muslim, that helped produce this vaccine, that invented it. So objective number 2 is, going back, preservation of life and health, and we look at vaccinations has preserved lives of millions across the globe. I mean, mortality rate and all the children that were dying because of diseases, that has all been eradicated through vaccines. This is scientific proof. And again, the maqasid, the objectives of the deen, are saying, in light of that information, in light of the science, in light of the facts of seeing that these vaccinations, and probably in the last 30 years, the greatest invention in science is vaccine, in terms of at least saving lives. And we see that millions of people have been preserved, their life has been preserved through vaccines. So that completes or fulfills the objective of life and health, and preservation of life and health. The objective number 3, preservation of progeny. Children, again, as extending from life and health, specifically children vaccinated are safer from certain diseases. Again, another objective of the Sharia that is accomplished through vaccines. Objective number 4, preservation of intellect and sanity. Community will be at peace of mind through vaccination. We are, look at what has happened to us in the last 10 months, 11 months, right? Close to a year. We are in such a state of mind that we don't even understand what's normal anymore, right? We've been in with such anxiety, people dealing with depression, going through so many problems because of this virus. And if this vaccine is out, and as we'll talk about the efficacy of this vaccine, the doctors already mentioned that 94%, 95%, depending on Pfizer or Moderna, that we are able to have that peace of mind, right? And we're hoping that, although it's early in the stages, but we're hoping we'll get there through this vaccination. And that is an objective of our faith, to provide preservation of intellect and sanity. And this will help us regain what is, again, normal for us, and how to normally to operate in this world. Objective number 5 is preservation of wealth and hifzul mal, and here it is cost effective for the economy to vaccinate. How much has the economy? I mean, one thing is to talk about a flu shot or different diseases, but particularly COVID-19. Look at the economy, the global economy, the impact that has had. And to take the vaccine is cheaper, to take the vaccine and venture on this journey towards freedom from this virus, or cure. As Allah subhanahu wa ta'ala has mentioned, that He's not made any disease or any ailment without its cure. And this is part of our faith, to believe that. Here we find that if the cost of taking this vaccine and globally implementing it is much cheaper than dealing with this virus for years and years to come. Again, objective number 5 is fulfilled through vaccination. The 2 approaches, just going back to 2 Islamic approaches. Again, number 1 was the maqasid of the Sharia, and number 2 is the Islamic medical jurisprudence, al-fiqh al-tibbi al-Islami. And these 2 are intertwined, right? We go to the maqasid, that's the objectives of the entire Islamic law, and we look at the Islamic medical jurisprudence, it's one aspect of that, which is again the health, keeping the progression of progeny, the preservation of health and life. So in regards to, in connection to that, this science, particularly in the Islamic medical jurisprudence, we need to understand how do we derive these laws? How do we attain what is right, what is wrong, what is permissible, not permissible? And we need to understand sources. So there are three sources: primary, secondary, and tertiary. And the primary sources are the Holy Quran, it's a holy text, the holy book, revelation from Allah subhanahu wa ta'ala, the Sunnah, the action sayings of the Holy Messenger, peace be upon him, and the observed behavior of the Messenger, peace be upon him. Those are the primary sources, the source of divine law. Then their secondary sources: consensus of the jurist, their opinion, which is the ijma', and the analogical deduction, which is qiyas. And then their tertiary sources, which are the legal maxims, and the al-qawaid al-fiqhiyya, and the formal legal opinion, which is the fatwa. This comprises, and we'll break it down briefly, but this comprises of how we go about navigating if an issue comes up, whether what action to take, right? Now, what is permissible, what is not permissible, and intertwined in this are rulings, and these rulings, which are known as hukum or plural ahkam, we find that through these sources we're able to derive whether something is obligatory, which is wajib or fard, recommended, mandub, or permitted, mubah, discouraged, makruh, or forbidden, haram. So you've probably known some of these words, or if not, then here are the rulings. And there are various other terminologies used while getting an idea, or following a methodology through the primary, secondary, and tertiary sources to derive this information and to understand how, as Muslims, we need to operate. Why am I talking about all of this? Because it relates directly to vaccinations. And I want us to contextualize this, make it easy for all of us to understand why I am saying what I'm saying in regards to vaccines, and in regards to what your situation is, what situation the world is in, your age, your strengths and weaknesses, to determine whether vaccination is right for you, and what does Islam say in general about vaccination. So the Quran, Allah subhanahu wa ta'ala first mentions that inna al-hukm illa Allah, that the hukm, the judgment, is verily alone with Allah subhanahu wa ta'ala. And he also mentions if anyone saves a life, it would be as if he saved the life of all humanity or humankind. We know that the study was done along with a placebo of 18,000 individuals who were given the vaccination, Pfizer or Moderna. They both did it. They both did the study prior to releasing these vaccines, and they did 18,000 people. They gave them actual vaccine, 18,000 the placebo, the fake. There was no vaccine, and they found that I believe the numbers were something like 8 or 12 individuals got the virus out of 18,000 that were given the vaccine, and then 18,000 that were not given the vaccine and a placebo, they got 162 got the virus. So that's where they derive the efficacy of 95%, 94%, which is huge, which is great. And that saves lives. That saves lives. That's proof right there that it saves lives, that people who are taking the vaccine are significantly less likely to contract the virus, and of course thereby to die. Death is in the hands of Allah. You know, some people you hear say that, oh, death is written. Subhanallah, what they're saying is true, but how they're saying it or what they're intending could be nothing further than the truth. Because to say death is written is correct, but to mean and imply that I don't need to protect myself, and I don't need to take care of, I don't need to research things and find out what I need to do, what's right, what's wrong, because everything is written. That's ridiculous. That's something that is close to a person, rejecting the qadar of Allah instead of accepting it, rejecting it, because Allah subhanahu wa ta'ala wants us to protect ourselves. He wants us to take these steps, and we will see in other verses and hadiths to elaborate. The Sunnah of Rasulullah sallallahu alaihi wasallam, as mentioned in the primary sources, number 2 for primary sources, and we have sent down the reminder messenger to you so that he can make clear to humankind what has been sent down to them, so that hopefully they will reflect. Again, the Sunnah has come to give us the guidance of how to implement the Sharia. A strong believer al-yadul qawi, a strong believer, he is better than al-da'if, a weak believer, more dearer to Allah subhanahu wa ta'ala. Mu'min al-qawiyyu, the mu'min who is stronger, he is preferred to Allah subhanahu wa ta'ala than a mu'min who is da'if, is weak. Again, showing us the objective of our deen to remain healthy, to remain strong. Why? Because you're able to do more ibadat. A person who's weak, Hajj is not easy. A person who is not able to, who's either diabetic or severe case of diabetes, or has some other diseases and need to eat every few hours, cannot fast. So being healthy and being strong helps you, enables you to do more. A person who's weak cannot pray all night, but a person who's strong can use that strength to worship Allah all night, right? So these are, again, guidance from the deen to be healthy, to be strong, and these are embedded as the objectives. Secondary sources, we look at consensus of juristic opinion, the ijma. Muslim jurists met on the issue of vaccination against polio, and in 2 days conference in June 2013, Islamabad, on the theme of this particular virus, this particular disease, they met to eradicate it in the light of Islam, right? So this is scholars meeting from all over the world, but primarily pushed by the Islamic University of Islamabad and in Pakistan, and the Al-Azhar University of Cairo in Cairo, Egypt. These universities scholars of these universities got together, and in June 2013, they declared a resolution adopting what the conclusion was, that parents who refuse to have their children vaccinated against it commit a sin, and such refusal are against the teachings of Islam. And why is this so important? They had to even condemn the killings of those people who were out there trying to protect the people from this disease, who were trying to get them the cure. They were being killed because, again, without knowledge, without understanding, people were saying, oh, what you're doing to the human body by giving them this cure, you are changing the creation of Allah. And that's not the case. As again, the Dr. Badr already mentioned, that this virus does not go into the cell. It doesn't go and change the DNA. It doesn't go into the nucleus. And we know this through people. We know, it's not that I've heard it from the news, I've heard it from somebody else, but rather I know it because my friends who are doctors here and anywhere you go know they are the experts. Allah says in the Quran that ask those who know if you don't know, right? If you don't know something, you need to go to a certain people who are experts in that field and ask them. And likulli fannin rijal, and every area, every science, every study has people who are the experts in that area, experts in that field, and they are saying that it doesn't go into the DNA, it doesn't change the DNA. Furthermore, who are the people that are on the front line to get the vaccination? It's the doctors, it's the healthcare workers. It's absurd to think that, you know, that the virus, the vaccination is something as a conspiracy designed to change the DNA and to kill people, when the first people that are getting it are doctors, are the healthcare workers that are trying to protect us, they're putting their lives on the line to help us get through this virus with the tawfiq of Allah subhanahu wa ta'ala. That the government or the people who are producing this vaccination are out to get the same doctors. It's just absurd. And you can see how absurd this logic is. Secondary sources, again, another one, which is the analogical deduction. And I bring these particular hadiths for you in order to understand how we should contextualize vaccines. Sayyidina Anas reports that the person came to Masjid al-Nabi, the Masjid of Rasulullah, and asked Rasulullah, should I tie my camel and have tawakkul, trust in Allah for her protection, or should I leave her untied and have tawakkul? And tawakkul is to put trust in Allah subhanahu wa ta'ala. Rasulullah replied, tie her and have tawakkul. In other words, vaccinate your child and then place your trust in your tawakkul in Allah subhanahu wa ta'ala. To say that, oh, if the child's going to get sick and is going to get sick, no. If you have vaccines and the study is there, 3 decades of studies there, that it has protected children, it has removed these diseases that they would get at in their early stages of their childhood, then do what is best. And the study, or the rumor regarding children getting autism and all these things because of these vaccines, again, that has been debunked. and the doctors are there to provide that information for you. But there was one study that was done has been debunked long time ago. The tertiary sources again are the legal maximums, al-qawaid al-fiqhiyya, and the theoretical. These are basically theoretical abstracts, usually in the form of short statements that are expressive, often in a few words, of the goals and objectives of the Sharia. And these are giving you some examples of the legal maxims, which are necessity makes the unlawful lawful, right? And then lesser of the two evils. These are again the last resort to figure out whether something that was not prevalent in the time of Rasulullah, the Holy Messenger, peace be upon him, or after that, and we don't have any verses regarding an issue or a hadith, then we can apply these legal maxims to derive a ruling. Formal legal opinion, which is the fatwa, a lot of us are aware of or hear about commonly, and this is coming from the Quran. Yastaftunak, they ask you, Ya Rasulullah, about an issue, about a matter. Qulillahu yuftikum, and Allah subhanahu wa ta'ala, He gives the fatwa, right? He guides you. So Allah subhanahu wa ta'ala directs you, which is yuftikum, about those who leave no descendants, and this is particularly about inheritance in Surah Nisa. So the fatwa are given on issues like economics, that such economic rules and regulations that the Sharia or Islam had not experienced before, but you can use these usuls, these principles, to then apply them even in current times. So economics, politics, science, and the list goes on, even down to vaccination. Debunking the myths, again, a lot of that we've already talked about vaccine side effects. As mentioned, it's the research that I'm not going to say that some people are not going to have side effects. And again, doctors will tell you the same thing, or rather experts in the field will tell you the same thing, that it's possible. But it's possible for someone to get a reaction from eating something, right? Eating candy or eating some kind of food or whatever, mushroom. So there are some people get some side effects and some people don't, but that doesn't invalidate the vaccination, which again, as we mentioned, is 94% successful. Yes, we need to look into ourselves whether our need is there for this vaccine or not, or are we okay to deal with it if the virus does come on us? These are things that a person individually can do, and fatwa is something that there are various individuals that are completely against vaccinations, and there are people that are pro. And fatwa is something that you yourself can make a decision. But we're here to provide you with all the information to have the education knowledge to make the best decision for yourself. Number two, debunking myths and dispelling concerns, conspiracies versus merit of immunization before onset of diseases. This is strictly based on the hadith of Rasulullah, as well as, of course, other verses in the Quran, where Rasulullah mentioned that whoever eats 7 dates of Medina, then they will be protected from black magic and poison. And Rasulullah essentially saying that if you eat healthy and if you build up your immune system by eating good food and superfoods, then you are protected. Allah subhanahu wa ta'ala will help you and enable you to get protection from these difficulties. So this is, again, preemptive measures that we're taking. Vaccination similarly like that we are taking this vaccine in order to protect ourselves from potential harm. And that is acceptable, not only acceptable, but encouraged and promoted in Islam. The porcine-derived components in vaccine, the good doctor already spoke about that. And again, there are no pork-derived ingredients in these vaccines, at least the one we know, which is the Moderna and the Pfizer. And I think there are 5 ingredients, if perhaps the doctor can list them for you. And none of them, the potassium, sugar, there's no metal in it. So all this is, again, new technology, as you mentioned, the mRNA. And it has none of these ingredients, haram ingredients. And we'll even talk about if it did have haram ingredients. In conclusion, the development of vaccines and getting vaccinated is generally encouraged in Islam. And to give you just the array of opinions and to help you understand whether you should get vaccinated or not, number one, you should, right? Number one, you should. If you feel that some of these vaccinations have haram-derived ingredients, remember that, first of all, we already know what the ingredients are, and you can research that yourself, you can find out yourself. And that's not information that's hidden or someone's hiding from you to inject you with pork-derived ingredients. I know that information is there, and the fact is that it's not. These ingredients are not there, and it's completely consumable, or rather, you can put it in your body. On the note that let's pretend that even if there were, pork or haram ingredients inside these vaccines, again, you would have to look, and the jurists would have to look whether that taking it, this haram, outweighs the harm of not taking it. As the verse in the Quran mentioned, talking about consumption of dead animals and consumption of khinzir, pork. And the verse in the end mentions that Allah subhanahu wa ta'ala is Ghafur Rahim. If you find yourself in a situation where you are not taking it because you want to, but rather there's a need for you, right? This is a clear verse from the Quran. If you take it because there's a need for you, and it's not because you are disobeying God, but rather you're protecting your life, right? And the example is given that if there's no food around and the only thing you have is haram food around you, and the only food you have is haram food around you, you can consume it to protect your life if your life is in danger, or you will lose your life if you don't consume it. Similarly, this applies to vaccines, where if there are no vaccines available and they're haram products, even then it's permissible to consume them so long as you realize that it's going to save your life. But the fact of the matter is, these vaccines don't have them, so that's even better. And for those of us who are elderly, you really need to think about this in the sense that if catching the virus, God forbid, may Allah make it easy, and at the same time catching a flu and another virus, that's a double whammy, and that's going to put you in a very difficult situation. If someone's young, perhaps and as the studies show, inshallah, they will get out of it. But as again the studies show, generally speaking, Allah knows who's going to live and who's going to die. But the individuals who are older, they will be hit harder, and in order to protect yourselves, get vaccinated. So these are again guidelines from the Sharia, information that I think is important for us to have, contextualize vaccinations in general. And I turn it over back to Sister Lamia. Jazakallah khair. Assalamu alaikum.
Thank you for a beautiful presentation, Imam Ibad. We do have a question regarding the religious implications of the vaccine, but for the sake of time, I'll go to our next speaker, Moses, and inshallah we'll return back to you.
Okay, let me.
Hello, you have 50. I mean, you have as much time as you need to get through your presentation.
It's not ending at 4 o'clock, right? Exactly.
That was our ideal time to end, but we run late. You're good as long as you have nowhere to be.
Okay, all right, no problem. I just wanted to be sure. Well, thank you all. Thank you, the Islamic Leadership Council, for inviting us to come. My day job is working with houses of worship. So when I heard that it was the Islamic Council that was the Leadership Council that was inviting, and the Health Department, I was delighted. And so what I'm going to do is, I don't have any slides to share, but I'm going to speak to answering some specific questions. And I'm going to start by saying Assalamu alaikum to everyone. What I am going to talk about is actually the process of the rollout of the vaccine in New York City, and who is currently getting the vaccine, and the timeline for when vaccine may be available, and of course, to common questions come up as to where can we get a vaccine, and those kinds of things. Is it free and that kind of thing, or is it something that everybody can get, so that one privileged group doesn't get more than the another group? So that's what I'm going to be talking about, and I will try to be as brief as I can be, because I know we are behind time. So today the question will be, where are we with the vaccinations in New York City? And as of yesterday, that was as a matter of fact, as of today, today is the 6th. As of today, 585,850 vaccines have been reserved for New York City, and out of that, the amount of vaccine actually delivered, is 480,000 2,550 vaccines. And the question is, okay, out of that, how many has made its way into the arms of people who need it? And thus far, we have 32,116 vaccines administered, delivered. That's the first dose. And we're happy to announce that, other folks have started receiving the second dose. And as of today, the latest numbers that we have is that 2,492 people had received their second dose. So we are, it's slow. The process is slow, but we are getting there. The question is, okay, we've heard, everybody has heard of the fact that, there's less vaccine relative to the population in the United States. So how is that being distributed? And of course, some of you may have heard that the guidance is provided by the CDC Advisory Committee on Immunization. And they set the guidance for the entire country. And when it comes to this New York State then set the guidance for for the state, for New York. Allocation of the vaccine itself is determined at the federal level, and is done based on the local population. The New York City, in particular, we receive our vaccines on a weekly basis, and again, like I said, the amount that comes in is determined by the federal government and then the state guidance. The Pfizer vaccine, that is shipped directly from Pfizer to the providers. And the healthcare providers, there is a registry, immunization registry, that folks, medical providers enroll. And for the Pfizer vaccine, is shipped directly to them. Now, for the Moderna vaccine, it's shipped to a partner that CDC works with. That's the medicine. That is the one that delivers the vaccine to the healthcare providers who are currently administering it. Now, we also know that Walgreens and CVS are partners in this, so they also receive a certain portion of New York City's allocation of the vaccine. The question is, who is receiving the vaccine right now? I know that sometimes it sounds kind of repetitive to say because we've been hearing this in the news all of the time, but some groups have been prioritized. The highest priority groups are healthcare workers with increased exposure, people in nursing homes and the other long-term care facilities, and then first responders. There are other prioritized groups, other healthcare workers, essential workers who are unable to socially distance, and people at higher risk of complications from COVID because of age or other underlying conditions. So, it's about, you have limited quantity and you have a population that you have to, prioritize. So that's the basis for, what we are doing. Now, often the question comes up to, when will the vaccine be available to everyone? And right now, because it's done in the phase, the population of New York City is over 8 million. And here we have what has been allocated to the city is still under 1 million. So it's kind of a phased distribution. And because of that, what we are anticipating is that it probably will be available to the general population in New York City by middle of this year. Of course, the vaccination has started with those priority groups that I spoke about. But then we have to also, because we are a city and everything is, we receive our guidance from the state. Actually, the prioritization of the groups is done by the state, and they determine also the timelines for these various prioritized groups. But the one thing New York City has control over, New York City Health Department has control over, is that we oversee the vaccine distribution for the city so that we can ensure that it's across the board and it's equitably available to all. So that is what is happening now. New York City itself has come up with, its own you know, timelines. I don't want to call it timeline, but some dates as, you know, the situation changes. So as of the week of January 4th, frontline high-risk public health workers were, you know, those that were now being considered. High-risk healthcare providers who provide direct in-person services. Those who work at COVID testing sites, hospital and community-based primary ambulatory care, primary care, outpatient health services, phlebotomists, physical and occupational therapists. They are all, and dialysis centers, they are all now folks who are beginning to be to receive it. And home care workers are also, and hospice workers are also now a part of those recipients. Now, beginning the week of January 11th, they are going to add on more prioritized groups. So hospice workers, for instance, home care workers will all be included. And then the question is, we're talking about all of these groups. Is the vaccine free? Because not all of the prioritized groups that we're talking about may have the ability to pay if it was. It's an issue of payment. So the answer is the vaccine is and will be available at no cost to everyone, even if you don't have insurance. And it has no restriction related to one's immigration status. And I know, being an immigrant myself, you know, the fear of the recent public charge tend to scare people away. That is not going to be a part of, it's not attached to this particular vaccine in any way. So folks who are here in the United States without documentation will also have equal access to the vaccine, just like any other person. And so, but if you have insurance, if you do have insurance, the insurance will be billed, or it may be billed, but you don't pay any co-pay. So it's going to be the question of you show up at where it's a facility that may be charging, and you don't have to worry about co-pay. You simply avail yourself to the vaccine, and then they'll take the rest of it with your insurance. The New York City Health Department is actually planning, if the website, and I'll give that to you in a minute, there will be a vaccination site map on the New York City Health Department website very soon. The question also is, where will I be able to get vaccinated if I'm eligible? So now it's about eligibility, because we are prioritizing. Not everybody will have the opportunity to receive it. So for those who are eligible, where can they get it? Now, most of those who are eligible are people who work in these healthcare sites, facilities. So that's where they were going to get it. In the New York City, on the New York City Health Department website also, we have a page where you can actually go, and then you see the site, the locations across the city, across the 5 boroughs, where you can get, they administer the vaccine. And just, I believe, 2 days ago, or just yesterday, the mayor, they announced we are going to have 5 mass vaccination sites in New York City, in all of the 5 boroughs. And that's why they've announced 3 in the Bronx, Brooklyn Army Terminal, and then in Manhattan. Queens and Staten Island will be announced very soon. And the goal of this is to let them operate 24/7 and to provide at least 100,000 vaccines per week across all of the boroughs. So that is the plan. Now, and then, of course, when it becomes available, then people or the general population will now be able to get it at places that they normally would get their vaccine. So like the healthcare provider, the community health, community clinics, pharmacies, and agent care, those are all places when the vaccine is more readily available, people will be able to access. And now the other question is, how do we ensure that people, not the privileged, so to speak, will have access to the vaccine, and the less privileged will continue to not, so what the city health department is doing is that, we are engaging with key messengers. Sake of speaking here, we recognize that the imams and the Dr. Al Hussein, right? You are all key messengers in particularly the Muslim community that we try to engage, and also we support all those healthcare providers in the neighborhoods that are traditional or historically been disadvantaged or disinvested in. We support those healthcare providers to enroll in the immunization registry, because that is one of the ways that you can receive the vaccine. So if we have hundreds of federally qualified health centers or community-based clinics, and they are in this neighborhood and they enroll in this registry, then of course they will have their share of the vaccines that they can then administer to the people that they service. We also monitor the immunization registry to see where things are going, where there's imbalance or inequity in terms of the administration of the vaccine. Then of course, we have to rethink access. So it's been monitored. And of course, there is a city vaccine command center, and that command center is also monitoring, access to the vaccine. But the most important thing that oftentimes would be a barrier to access to the vaccine is cost. And so of course, for immigration is a big thing. So we are making sure that those become no barriers. Those are removed so that people can access the vaccine. And so that is where we are. And but the vaccine is just one tool. We are still in the midst of the pandemic, and you've heard people say that we may yet be experience the worst situation before things get better. So we have to keep getting tested. We have to continue to wear our face mask, washing our hands, and keeping ourselves socially distant. And of course, with all of those and the vaccine gradually rolling out, we are very sure that things will get better in the city. But I want to emphasize that the New York City Health Department website, and I know that I don't have slides to show. I wasn't showing slides, but if you go to the City Health Department website, I'm going to say it. I know that it's a very long web address, but I'm going to say it's www.newyorkcity.gov, that's gov/COVID/COVID-19 vaccine locations .page. If you don't have to do anything, just go to the or the health department website and type it, and then you'll find it. But I just want you to know that if you go to this website, the website is loaded with very good information, and then it has answers to most of the questions that one would have. And I will end my talk here. I believe I took only a couple of minutes, right?
Yes,
I'm going to pause.
Thank you so much. Thank you so much, Moses, for coming on to our webinar today. You provided very useful information. Just want to clarify one thing. So the vaccine is free for anyone who's considered eligible for the vaccine, correct?
That's correct.
And eligibility is determined upon a few different factors. For instance, whether you work in the health industry, high risk. Okay.
Yeah. So yeah, that is so, and we have to say here, eligibility is just for the moment, because everyone is going to be eligible down the line. So for when we talk about eligibility, it's looking at what is in what category are you prioritized? Are you a healthcare worker? There is even the website that I was talking about. There is a form that when you go there you can actually go in and to set up an appointment if you think that you are. But if you're not eligible and you go there to set up, not because there are some requirements, they're going to require you to show proof that you're actually eligible. And so you also have to fill out a form, which is what you carry even to the place where you're going to receive the vaccine. So eligibility is determined at the moment, at the particular time that at the particular time, let's put it that way.
Yes, of course. Maybe you mentioned this already, and maybe I didn't catch it, but is there an estimated timeline of when everyone will become eligible? Is maybe like an estimation, maybe by what point in the year?
Yeah, so you are breaking up a little bit, and I think there is from my side, but I guess the question was about will everybody will be eligible at what time of the year?
Yeah, is there an estimated timeline of when everyone will become eligible?
That is our expectation is that by middle of this year,
okay,
it should be available to everyone. So the availability not be, if you're not in this prioritized group, the only people that it may not apply would be those that are below the age for whom the vaccine has to be tested. So middle of this year, we're expecting that. It could be sooner, I don't know, but that's the best estimation that has been given to me as a speaker.
Okay, thank you so much again, Moses. It was such a pleasure having you.
It was my pleasure being here, and I am going to be engaging with you. Remember, my office is the Office of Faith-Based Initiative, so you'll be hearing more from me.
Always a pleasure. Thank you so much, Moses. Okay, so we didn't get that many questions from the community. We did get one regarding religious implications. Unfortunately, our sheikh had to leave. He had another commitment, but I think this is something I can answer, hopefully. So the question is, does mandatory vaccination violate individuals' rights to medical decisions and religious principles? And if the compulsory vaccination contradicts religious principles, then what is the solution in this case? So from what I understand, after Sheikh Ibad Wali's presentation on just the religious implications in general, it doesn't seem, at least in the case for Muslims, I can't speak to other religious communities, but it doesn't seem to be the case that taking the vaccine will necessarily violate a person's religious principles, considering that the fiqh of vaccination in general is quite lenient in the case after Sheikh Ibad Wali presented his case. However, it also doesn't seem to be the case that the vaccines are currently mandated or compulsory. Maybe Dr. Badr can weigh in on this topic.
Yeah, so no, for that, the vaccines are not mandated. Even for healthcare workers, it's really not mandated. It's strongly recommended. And, this goes in terms of vaccines and in terms of like the medical profession as a whole. Like I did want to mention this in my presentation, but some of these myths that come out are not necessarily, they can be debunked, but they're coming from a place of suspicion. Unfortunately, the medical field, and especially when it comes to people of color, has had a history of improperly experimenting on people. There's a great book by Harriet Washington called Medical Apartheid that really goes into in depth, especially when it comes to, the Black American, and indigenous populations, and we've had this throughout. And within medical, the medical profession as objective as it is, has had a history and tied to a lot of the innovations that were found were tied a lot to eugenics and to some of these, fascist movements that came out, or xenophobic movements that came out, like in World War II and stuff. But ever since then, we've a lot of when the Geneva Conventions or the Geneva Accords, Human Rights Convention was put on, and WHO was formed, and all of these things. A lot of these things were mitigated, and we do have ethics that we have to follow. So when it comes to these individual mandates and stuff like that, the vaccine is not required for COVID specifically. It's not required by even for people in the healthcare field. Even in my institution, and maybe I don't know if Dr. Mansour, Dr. Moses can elucidate on that. It's not required at the citywide either. So So and part of it is because of the religious reasons and stuff like that. So will it be down the line? That's a question to be yet to be answered.
Right. Thank you so much, Dr. Badr. Once again, thank you to all of our speakers for joining this really important panel. Just to follow up on what Dr. Badr mentioned, next week there will be another panel organized by a series of wonderful Black community leaders on the topic of COVID-19 and mistrust within the Black community. We will be sharing it on our social media just to remind the community about it. And once again, thank you so much, everyone. Jazakallah khair.